Liver cirrhosis causes, symptoms and treatment of a disease. Interesting about science and medicine prepared by editors of a page All Scientific. Liver cirrhosis is a dangerous, destructive disease in which hepatocytes, liver cells, are damaged and scar tissue forms in their place. The more the number of damaged hepatocytes increased, the faster the liver function is disrupted. Severe damage to liver tissue can cause liver failure or even death. Due to cirrhosis, blood circulation in the liver deteriorates. Poor circulation in this internal organ causes increased blood pressure in the blood vessels that direct blood to it. Thus, varicose vein of esophagus may often be noticed in patients with cirrhosis. Often this vein cannot withstand the pressure and become damaged. Attention! Every year 500,000 dead from cirrhosis around the world. Unfortunately, the evolution of this disease cannot be interrupted, and a cure for this severe disorder can only be achieved through liver transplantation. With early signs, the disease can be stopped or slowed down. Attention due to the danger of this disease. If cirrhosis is suspected, the patient should consult a doctor immediately. The severity of this disorder is directly related to the damaged organ, thus is the liver. Symptoms of liver cirrhosis. Most often the disease makes itself felt only in the last stage. The main signs of cirrhosis are spider-like blood vessels on the chest or shoulders, menstrual cycles disorders in women, loss of sexual desire, breast enlargement in men, fatigue, sleep problem, redness of the palms, swelling of the legs and arms, prolonged itching, abdominal enlargement, blood vomiting, black stool with blood, dark colored urine, jaundice of the skin and eyes, significant weight loss or gain. When to see a doctor if you have cirrhosis? Given the dangerous nature of this disease, it's recommended to immediately consult a doctor if you notice these symptoms: spider-like blood vessel on the chest and shoulders, menstrual cycle disorder in women, loss of sexual desire, breast enlargement in men, fatigue, sleep problems, redness of the palms, swelling of the legs and arms, prolonged itching, abdominal enlargement, blood vomiting, black stool with blood, dark colored urine, jaundice of the skin and eyes, significant weight loss or gain. How much does a human liver weigh? The weight of this organ in an adult is 2.5 kilograms, and in size it can be compared to a soccer ball. Yes, the liver is the largest internal organ in our body. The most important function of a liver are production of bile, maintaining normal blood composition, toxification of body from such chemicals, destruction of damaged red blood cells like the spleen, maintaining immunity by eliminating viruses and bacteria in the blood. Just think what can happen if function of this organ is disrupted. The liver tolerates its own destruction very well. This organ can work even if about 70% of its weight is destroyed. Of course, it will work less efficiently, but it will still do it. If a cause of a disorder is eliminated, the liver tissue is restored. This is a unique property that not every internal organ can boast of. It is possible to live a complete normal life with even a few lobules of liver tissue, when the rest of the organ is replaced by scar tissue. The main thing is to identify the disease at the right time. There is a point in the development of liver cirrhosis beyond which little can be done to help the patient recover. The fewer healthy hepatocytes remain on duty, the harder it is for them to maintain all liver function. Thus, many irreversible changes occur that will haunt the patient through his life. Causes of liver cirrhosis. The occurrence of cirrhosis is mainly associated with the influence of negative factors on hepatocytes. The most common causes of cirrhosis are alcohol abuse, long course of drug treatment, prolonged exposure to harmful substances on the body, long-term bile obstruction, genetic defects, viruses. Alcohol. Alcohol plays a special role in the development of cirrhosis, although many studies have shown the positive effect of small doses of alcohol in preventing stroke and other cardiovascular disease. Alcohol abuse can cause serious damage to the liver. For example, we have heard that French suffers least from cardiovascular disease because they drink a lot of wine, but no one tells us that the same French suffer from cirrhosis of the liver more often than other nations. Many doctors have noticed that citizens who abuse alcoholic beverage die faster from cirrhosis when they manage to protect their cardiovascular system. The more and more often you drink alcohol, the higher the risk of this terrible disorder. Because of difference in metabolism in men compared to women, gender plays a role in the risk of cirrhosis. Men can consume about 2-3 glasses of alcohol daily without harm to this internal organ, while women can only drink 1-2 glasses. People who frequently deal with large quantity of alcohol should make an appointment with a doctor to avoid hepatocyte destruction. Why is too early doing this? The fact is that the first noticeable signs of a disease are noticed very late, and an examination by a doctor can reveal early symptoms. Alcoholic hepatitis. With alcoholism, some patients may develop alcoholic hepatitis. This disorder can last about 1-2 weeks and cause the following symptoms: confusion, jaundice, loss of appetite, temperature increase, nausea. As you understand, like any disorder of hepatocyte function, alcoholic hepatitis can evolve to liver cirrhosis. Fatty degeneration of hepatocytes, fatty hepatosis. People who abuse alcoholic beverage may also have another disorder, fatty liver degeneration, fatty hepatitis. This disorder is characterized by enlargement of hepatocytes due to the accumulation of water and fats. The main symptoms of this disease are temporary jaundice, various anomaly at the level of hepatocytes. Attention, fatty hepatitis can also occur for other reasons, diabetes, obesity, malnutrition. Viral hepatitis. Another important cause of cirrhosis is viral hepatitis, a general term for inflammation of the liver. Only two forms of hepatitis can cause cirrhosis, form B and C, typically scar tissue being to form after 6 months when hepatitis becomes chronic. At first, symptoms may not be noticeable, so patients may not even be aware of negative change in the liver. After some time, damage at the liver level becomes more pronounced, increasing the likelihood of acute cirrhosis. This is why people with hepatitis are advised to undergo regular medical examinations. Due to the infectious nature of hepatitis, when the diagnosis of a disease is confirmed in a patient, all family members are recommended to undergo medical monitoring. Wilson-Konovalov disease. Wilson-Konovalov disease can also be the cause of cirrhosis. Wilson-Konovalov disease is a genetic disease in which, due to a genetic problem, the body is unable to absorb copper. This large amount of this metal accumulates in various parts of the body, especially in hepatocytes. As a rule, the accumulation of copper in the liver is a cause of cirrhosis. Hemochromatosis. Hemochromatosis is a disease similar to Wilson-Konovalov disease, only instead of copper, iron accumulates in the tissue of the body. By the same principle, an increased concentration of iron in hepatocytes leads to serious change in the liver. This disease most often affects men aged 40-60 years. Hemochromatosis is less common in women because they lose iron during menstruation. Galactosemia. Galactosemia is characterized by a violation of carbohydrate metabolism, more precisely carbohydrates from milk. A healthy person consuming milk releases milk carbohydrates without risk to health. In this disease, due to absence of certain enzyme, milk carbohydrates accumulate in the liver, becoming toxic. Without proper treatment, galactosemia can be fatal. In this disease, it's observed in newborns. It is recommended to refuse normal milk and give lactose-free milk. Congenital defects of bile ducts. Some newborn babies are born without bile ducts or with certain deformation of these ducts. Because bile cannot be secreted naturally, it accumulates in the liver and poisons it. Gallstones cholelithiasis. Cirrhosis can be cause of gallstones. This formation block or impair the secretion of bile. Environment pollution may increase the risk of cirrhosis. Contributing factors for the formation of gallstone are taking certain medication, isoniazid, methotrexate, exposure to toxic substance from environment, arsenic-based chemicals, pesticides. Diagnosis of liver cirrhosis. Based on the patient examination and symptoms, the doctor can diagnose cirrhosis of the liver. To confirm the diagnosis, the doctor may require liver tests, which consist of a blood test. Using a blood test, you can determine liver disease and assess the general condition of this internal organ. Also, the doctor may require a biopsy of liver tissue to determine the cause of cirrhosis. This procedure involves inserting a special needle into liver to remove a sample of liver tissue for laboratory analysis. Treatment of liver cirrhosis. The main principle of treating this disorder is to eliminate the cause. The main recommendation for treatment depending on the cause of this disease may be change in diet, avoiding contact with certain environmental chemical, treatment of disease hepatitis A, some hereditary disease. Complete cessation of alcohol consumption. Treatment of liver cirrhosis. Treatment of cirrhosis depends not only on the cause of a disorder, but also on its stage. The main goal of treatment is to stop the progression of a disease and eliminate complications, for example, bleeding. If the cause of cirrhosis is alcoholism, then the patient simply must stop drinking. When confirming this diagnosis, there are the following statistics. Patient who continue to drink has less than a 40% chance of living more than 5 years. Patient who not longer drank had a 60-70% chance of living more than 5 years. Complete abstinence from alcohol consumption also help in the treatment of other liver disease, alcohol hepatitis, fatty degeneration, hepatocytis, fatty hepatosis. Both diseases disappear if the patient abstains from alcohol for a long time. The main recommendation for the treatment of cirrhosis resulting from chronic hepatitis are proper nutrition, relaxation, administration of interferon less often. Unfortunately, not all types of hepatitis can be cured. Treatment for Wilson-Konovalov disease. Treatment for Wilson-Konovalov disease involves taking medication to remove copper from the body. As a rule, for Wilson-Konovalov disease, these drugs should be taken for the rest of the life. Treatment for hemochromatosis. The best treatment for hemochromatosis is considered to be regular extraction of certain volume of blood, usually 1-2 times a week. Such procedure should be carried out for about 1-2 years until the level of iron in the patient's body normalizes. After this, the procedure is done once every 2-4 months. Liver transplantation. Very severe cases of cirrhosis may require a liver transplant. This procedure, due to its particular seriousness, is resorted to only as a last resort. The fact is that this type of treatment may not be suitable for everyone. Some patients might be too young, others too old, and some too sick to be treated with a transplant. Patients with cirrhosis due to alcohol abuse must confirm their categorical abstinence from alcohol before surgery. As a rule, doctors refuse to perform liver transplant on people who continue to drink alcohol. As with any surgical intervention, transplantation of this organ is accompanied by certain risk. The new liver may not work properly, the body may reject the transplanted liver, there is a risk of infection as a result of the operation. In Western countries, there are the following statistics on liver transplantation. In 60-75% of patients, the transplant is successful. 90% of children successfully undergo the operation. On average, a person with a transplant of this organ lives about 5 years after surgery. How to treat yourself at home. The main goal of traditional alternative medicine is to maintain the normal function of hepatocytes and to partially improve a patient's condition. Some Chinese medicine can improve the function of hepatocytes to normal. Still, keeping in mind the seriousness of this disease, self-medication is strictly prohibited. Attention, you should take such medication only after consulting an experienced specialist. Milk thistle. Milk thistle has been observed to stimulate normal liver function. Attention, it is not recommended to take such drugs without first consulting a doctor. Nutrition for cirrhosis. Proper nutrition for this disease is a very important tool in treatment. Even if some parts of the liver have been replaced by scar tissue, proper nutrition can stimulate the development of healthy hepatocytes in undamaged area. Particularly important food products are vegetables, cereals, milk, protein, fruits. Optimal amount of protein. The key element in the case of liver disease is protein. Too little protein in the diet slows down cell repair, while too much protein in liver disorders increases blood ammonia levels. An increased concentration of ammonia in the blood leads to mental disorders. Attention, talk to your doctor or dietitian about your recommended daily protein intake. Be careful with medication. Due to the fact that hepatocytes filter and process all nutrients entering the body, even when taking vitamins, it is recommended to consult a doctor. Attention, strictly avoid high dose of vitamin preparation. Avoid consuming raw shellfish and crustacean. To prevent infection with one of the hepatitis virus, do not consume raw crustacean or shellfish, especially from contaminated areas. Prevention of cirrhosis. If you are a regular consumer of alcohol, do not exceed the permissible limits. Men can drink about 2-3 glasses of wine a day every day. Women can consume about 1-2 glasses of wine without harm. Attention, this meaning may vary from one person to another. Typically, doctors recommend drinking about 1-2 glasses of wine per day and not consuming it daily. Avoid consuming raw shellfish and crustacean. Never drink alcohol while taking medicine. Avoid area contaminated with various toxic elements. Eat healthy. Particular attention should be paid to recommendation for avoiding hepatitis infection. Before traveling to country where there is an increased risk of contracting hepatitis, it is recommended to consult a doctor about possible vaccination or immunoglobulins. Immunoglobulin injection give the body the protein it needs to protect itself from the virus. while the vaccine stimulates the production of its own antibody. Due to the fact that the liver processes most medication, ethyl alcohol and toxins, in case of cirrhosis it is strictly forbidden to load this organ with such chemical. Taking any medication in such patients may differ from healthy people. Before taking any medication, for example contraceptive, antibiotics or paracetamol for liver disorders, it is recommended to consult a doctor. Thank you for your attention. This material was prepared based on material from the channel All Scientific. Attention: before using any treatment and remedy, it's recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.